Of the more than 15 children who would have died from COVID-19 since the start of the pandemic 2 years ago, the majority suffered from underlying health conditions such as cancer and renal failure, which saw them being admitted to the COVID-19 intensive care unit. Notwithstanding, all categories of students are expected to return for in-person school next month, whether or not they have been diagnosed with a comorbidity. Current research shows that children or adults with underlying medical conditions are at a high risk of a serious outcome once they contract COVID-19. As such, it is very important for them to be provided with a layer of protection through vaccination, which can prevent them from becoming critically ill or possibly dying. Health Minister Dr. Frank Anthony several weeks ago announced that Guyana is making steps to acquire vaccines for children between the ages of 5 to 11 years old, as well as those from the 6 months to 5 years old age group. He said specialized vials for this purpose were being sought from Pfizer. When asked by Nightly News recently for an update on the vaccines, he said that government is now pursuing other arrangements to attain the jabs.
So CARICOM was working to see whether they can make an arrangement for the region, the Caribbean region. So they have started discussions with Pfizer, and we have given them our numbers of how much we would like to get if they're successful in those negotiations. So that's one thing that we're looking at, and we have some other arrangements that we're pursuing.
When pressed on whether it is safe for the students to return to the classroom without being inoculated, the minister pointed out that generally most children with COVID-19 make a quick recovery and do not require medical treatment. However, for the cohort of children with existing comorbidities that are expected to return for in-person instruction, their parents can seek medical advice in advance, the minister urged.
I think that would be something that their parents would have to discuss with the child's doctor and decide on. But that would be a tiny minority of children.
Minister of Education Priya Manikchand has not yet officially pronounced on the reopening of schools and the way forward. It is unclear at this time whether or not children with comorbidities will be given the option to participate in virtual learning sessions. There has been a phased reopening of schools since the pandemic started. Children below 12 years old have been engaging in virtual classrooms. Vaccines are currently available for children between the ages of 12 to 17. However, the uptake in accessing the jab has been significantly slow. Health authorities have implored parents to provide the requisite consent so that their children can be vaxxed. As of Tuesday, in excess of 34,077 or 46.7% of adolescents had received a first dose of a COVID-19 vaccine, while more than 24,723 or 33.9% were fully inoculated. Temika Rodney reporting for the HGP Nightly News.